All right, I want to go over a very simple exercise that often gets done wrong and trains the wrong muscle around your hip. So I think you will like this as you do it properly. So it's called the hip abduction, or the Jane Fonda. Jane Fonda had it right back in the day when she was doing all these leg lifts. Many of us, male and female, have weak gluteus medius muscles. Super important that we train them. A lot of times I see powerlifters and bodybuilders to recreational athletes that have weakness of this lateral hip muscle because we don't really move laterally. We don't move side to side in our normal daily life. We're sitting, we get up and we walk forward, we run, or we lift, and we're going in one plane of motion. And we can hurt ourselves if our body, our spine, pelvis, and whatnot are not stabilized from all angles. So again, this is a very simple exercise when done properly, and it's very effective. So really important. So lie on your side. I like to just kind of cradle your head in your lower arm, okay? Lower both legs down. Come up here a little bit. So your feet are even. I like to do that so your pelvis, everything's kind of straight and aligned first. We're gonna bend that bottom leg. Core is just nice and easily engaged. You're not kind of bearing down really tightly, you're just keeping it engaged here. That top leg with your brace, deep abdominal breath, you're gonna gently pull that leg back, not super far, but just a little bit. And then from there, you're going straight up, okay? Knees staying straight, toes are up towards you. You're thinking about lifting the outside of your heel of your shoe, okay? We're not twisting the toes up and out, you're keeping them forward. Very important so that we train the right muscles right around that hip, okay? It's easy to start to lift forward and use the muscle that's called your TFL, or your tensor fasciae latae. We don't want that. That's right where your pocket is. That often gets very tight. Again, sitting all the time, this muscle, we're driving, whatnot. So we're trying to get our hip extended just a bit, but then really important, just lifting with the gluteus medius. If you push your hand right here, you feel that bone called your greater trochanter. If you come up right above it towards your pelvis, you should feel that muscle contract under there. If you don't, and you feel it all up in the front, I want you to try to slide that heel back. If you need, you can put your back against a wall with some socks on, keeping your butt there. Push that heel back as you lift and come down. Slow and controlled. Now, dosing. You want to hit like 40 reps or so, 30, 40. You want to get a lot of volume with that so that muscle doesn't fatigue out during your daily movements. The other reason this is important is this muscle, your gluteus medius, has to contract with roughly like 2.5 times your body weight every time you step. Every time you land, you're running and it contracts and it holds up that body and it wants to torque down. So this muscle has to really engage to stabilize your low back and your pelvis and your femur, your legs here. So guys and girls, you should both be doing this, I would recommend. So make sure you practice, make sure you do this at least a few times a week. You don't want to do it before you lift heavy, but maybe after you're done or part of your morning routine, get your glutes woken up, whatever you want to do. Just do a few sets of 40. If you can't get to 40, that means you don't have the endurance yet. So break it into bite-sized pieces, whatever you can do to work up to that, and watch your butt get stronger.